Welcome to the Skin Crest Clinic Dermatology Podcast. I am your host, Dr. Praveen Banodkar, consultant dermatologist practicing in Mumbai at Skin Crest Clinic. I thank you for joining today's podcast that covers everything related to skin, hair, and nails. In this episode, we would be discussing a snippet of a case. Last evening, I had this boy come into the clinic. His feet were swollen and painful, and so were his hands. On his legs, there was a rash that exploded over the several hours into a series of raised red rings. He was crying incessantly to his parents and that he could not tolerate the itch. There was accompanied lip and eyelid swelling that came up over a period of a few hours. Parents realized that this was something unusual and brought him to the clinic to know what their child was suffering from. This is called urticaria or hives or a nettle rash. This condition consists of wheals, spots or patches of raised red skin, each of which usually clears away in a few hours to be replaced by other fresh wheals or swellings in other parts of the body. It can present in a very subtle format or in a dramatic presentation, what I experienced yesterday. Urticaria is very common and affects 1 in 5 people at some point in their lives. The more common type of urticarial rash lasts up to 24 hours and produces larger wheals and may not completely clear for several days. It sometimes occurs together with swelling on various parts of the body, specifically the eyelids and the lips or the palms, although any other place may be affected. So what was the swelling of the lips and eyelids? That is called angioedema. Angioedema is a form of allergy where there is a deeper swelling affecting the skin over the arms, legs, torso or face. It can affect the tongue, mouth, throat and sometimes the upper airway, and that's when it becomes an emergency situation. These swellings commonly last for more than 24 hours and usually there is no itching. However, there might be a pain on the palms when the swelling is present. It is not possible to identify an underlying cause for angioedema in the vast majority of the cases. Urticaria and angioedema often occur at different times or together in the same person. They occur in about 15% of the population at some time or other in their lives, with women more commonly affected than men. There are 2 aspects of treatment for urticaria: avoidance of any reasonably suspected trigger and treatment with medications. Individuals who have urticaria are commonly prescribed antihistamine medications by the family physician or dermatologist. It helps to control the itching, the irritation and local swelling, and when taken regularly it can prevent episodes occurring in a very chronic spontaneous urticaria case. Sometimes there are prescription medications needed to control the urticaria and a blood workup that is needed when ordinary antihistamines do not control the symptoms effectively. These medications vary from steroids to injectables like biologicals called omalizumab that can be taken as a monthly injection even by the patients themselves. However, it needs a thorough workup and study and monitoring by the dermatologist. Hope you all enjoyed listening and gathered some valuable take-home messages in today's discussions. Thanks for tuning in. For dermatology appointments, you can send a WhatsApp on 9867 955 944. Take care, stay safe and stay healthy.